and I've already talked to you about it. While you're sitting there, or you can stand up and try it, imagine that you'd like to lift your knee up, but your foot is super glued to your thigh is super glued to the chair, and you can't lift it, but try hard and try harder. And it won't come up, it'll come up a little bit, but try harder and try harder. You should feel that core engage. The idea behind back hab is that we have three major movers in terms of muscle function: the prime mover, the synergists, which are the helpers, and the stabilizers, which help to stabilize. The prime mover is the more superficially placed muscle usually, and it's the one that gets the action going of what you actually want to have happen. What happens is that our bodies find the easiest way to do things, and the easiest way to move is from the outside in. So when you see people doing hip abduction, adduction, then most of the times they're not vertical. They're like this, or they're like this to get it, to keep themselves balanced. And so we would like them to use core instead of the more superficially placed muscles. The hip joint takes a huge beating during our lives. And by using the heavy concept, if you think about lifting that leg again, you'll feel that the effort is in the core, not in the hip flexor, not in the iliacus and psoas. So that's what we want. We want the effort to go back to the core because that's where balance is. And it's good for the joints at the same time. Okay, so we just do some heavy, 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 and heavy, and that helps. But it's got to be done with upright alignment. Otherwise, you're teaching people every single time we are working with people, we're doing neuromuscular retraining. And if we teach them and let them do knee lifts, let them bring their knee up and their torso forward, that's what they're always going to do. So we need to teach this, that they lift it, that it's heavy, and they maintain upright alignment. Okay, so heavy can also be used as reverse heavy. I call it reverse heavy. This is just neuromuscular retraining, but my clients don't understand that. Lift your knee up. Wait until I'm done explaining it, or your leg will be tired. Lift your knee up. Imagine you have surgical tubing tied just superior to the knee joint, and it's anchored to the angels in the sky, and they're holding it up. Okay, now you can lift it. And you want to put it down, but it won't go down. And you want to put it down, and it won't go down. You should feel the effort in the glutes. It takes the effort to the core. You shouldn't feel it radiate up into the low back. But some people will try to press it down by pushing their chest forward. That's because that's what their bodies have trained them to do. So heavy, reverse heavy. If you stand up, if you're willing to stand for a minute, imagine the tubing around your ankles, and that you want to do hip abduction, doesn't matter which leg, but that tubing is holding you, holding you, holding you. You're trying to lift it out, and it's still holding your ankles together. You should feel that effort in the core, not just in the legs. So try the other leg too. And then let's try reverse heavy. Your leg is out. The tubing is around the ankle. Angels are holding it up and resisting it for you. And then imagine you want to pull it down, but you can't. You should feel this. You should feel the core engage. That's the whole idea. Couple of things. One, I have people not be able to do it first, so that I told you that the muscles have the proprioceptive trace, and they know what they're supposed to do. They know the order they're supposed to work in, instead of just have them think heavy. However, if you've got a client who's got hypertension or some other pain issues, then possibly you don't want to have them just not be able to do it, because when you're pulling down and you can't do it, the natural inclination is to go into the Valsalva maneuver and hold your breath against a closed glottis, which is not good for people with hypertension and things like that. So watch how you teach heavy. Know that you can't do many repetitions, because after the fifth or sixth one, people will start to, they'll be gone. And this is very cognitive. If you don't have clients who have good cognition, it's not going to work for them either, because it's the thought. It's not the tubing. If you actually use the tubing, people will still work from the outside in. Try putting tubing around somebody's knee, and they'll just push down the way they normally do. It has to be cognitive. Okay. There was something else that I thought of, but I can't remember it. And hopefully I'm remembering it now, and I'm going to tell it to you in a moment. So the heavy concept, working from the inside out, excellent for balance because core is balance, in my opinion. Okay, heavy concept. We used it for weight shifting. So we can use it for a lot of things, but weight shifting is a good idea. Teach people to move from the core. We used it for turning skills. Teach people to move from the core. We can use it for upper extremity, for shoulder flexion, extension, abduction, adduction, internal and external rotation. It works for all of it. So if you want to use it on a specific joint, that's fine. But if you just want to make sure that the core is working where it's weakest, it's usually lower extremity movement that does that is the hardest to get the core engaged.